All right. Well, good morning. How are you?
I'm doing okay.
Okay. My name is Michael. I'm going to be your nurse, and the doctor has some orders here. I just want to go over with you. Um, and so, first of all, we're going to do a set of vitals, which is just checking your blood pressure, your pulse, and your respirations. And then he wanted to do a respiratory assessment on you, which is just listening to your lungs. And then also do a cardiac assessment, which is just listening to your heart. Is that okay with you?
Yeah, that's fine.
All right, perfect. And what can you just verify with me? What is your name and date of birth?
Ashley Reed, 12/10/1987.
Perfect. All right, I'm just going to wash my hands and we'll get started. So I want to start out with the pain assessment. And so I'm just going to ask you a few questions. So first of all, are you in any pain right now?
Yes, my shoulder hurts.
Okay. And so that's your left shoulder.
Yes.
I'm just going to take some notes if that's okay with you.
Sure.
Okay. And when you first noticed it, what brought it on?
Probably stress.
Okay. Stress. Is there anything that makes it better or worse?
Getting off work makes it better. It's worse to be talking to a stressful client.
Okay. What does it feel like?
Sort of like there's like a rock right here.
So tightness?
Yeah. Feels sore.
Okay. Mm-hmm. Now, does it go anywhere else, or does it just stay in your shoulder? Does it radiate down your arm any, or down your back any?
I have some pain in my arm, but I don't think that's related. I think that's from typing so much.
Okay. So not with your shoulder, though?
Right. No.
All right. Now, on a scale of 1 to 10, 10 being the worst pain you've ever felt, what would you rate that pain?
I'd probably say like a 3. It's not
Okay.
too terrible.
All right. And do you remember when the symptoms first began?
Probably today.
Okay. So just today.
Mm-hmm.
Now, are you taking any medications for it?
No.
Okay. Now, how's this affecting just since it just started today? How's it affected your everyday life? Or is there anything that you're unable to do because of the pain?
No, I shift a lot during work, trying to alleviate the pain.
But it doesn't prevent you from doing anything, or doesn't change your everyday life?
No.
All right, perfect. Well, I'm gonna go to our next thing, which I'm gonna assess your blood pressure, if that's okay with you.
Sure.
All right, and can you roll up your sleeve at all?
Sure.
Brachial artery.
Do you need me to roll up my shirt more?
That would be perfect. All right, just go ahead and relax. And do you know what your normal blood pressure is?
I think the last time it was like 110/97. Okay.
Okay, we got 118/78. Clear down. So the next thing is I'm going to feel for your radial pulse, which is in your wrist. This one. Okay, so you had a pulse of 72. Also, I checked out your respirations while I was doing that, and respirations were 18. There was no signs of labored breathing in your or deep breathing or anything like that, which we call eupneic breathing, which is just normal breathing. I'm just gonna make some notes here. 2. Okay, perfect. So now I'm going to go into a respiratory assessment, and we're just going to listen to your lungs. And so, if that's okay with you. Okay. I'm also looking for any discoloration in your skin, which would be a sign of any trouble breathing or anything. And now, have you had any shortness of breath at all?
Not that I can think of.
Perfect. Okay. So you're here back. That's okay.
Okay, that's fine.
And I'm just going to go just to the right of your sternum on your second intercostal space. And every time I touch you, I just need you to take a deep breath. Okay? All right. So I just listen to your right upper lobe. Now I'm going to move to your left upper lobe. All right. And if you could just lift your breast up, I just need to go right underneath, right here. Perfect. And this is listening to your left lower lobe, and I just need you to take a deep breath. Now just listen to your right middle lobe. All right, and now I just need you to cross your arm over. Just put it right there. I'm going to listen to your left lower lobe. Just turn this way and take your arm and cross it over, and we'll listen to your right lower lobe. Okay, perfect. Make a few notes here. All right, and I'm going to also check. I'm just going to move your hair to the side.
Okay.
Also check your posterior breast sounds.
Okay.
So I'm listening to the right upper lobe. Take a deep breath. Move to your left upper lobe. Take a deep breath. I'm just going to go down and listen to your left lower lobe. And we'll move over and listen to your right lower lobe. Okay, perfect. Okay. Now the next part of our assessment, first of all, have you had any coughing recently?
Yeah, a little bit.
Okay, perfect.
Yeah.
All right. And has there been any like sputum? Has it been productive? Have you coughed anything up?
A little bit of mucus. Not
Okay.
all the time.
And what color was it?
It was like a yellowish.
Mhm. All right, so I just want to educate you on a few things that might help you with that. It's actually called turn, cough, and deep breathe.
Okay.
And so all you would do is take a deep breath in and then turn your head to the left
Okay.
and then cough. Yeah. And then what that does is it will loosen any mucus that might be in your lungs and help you make it more productive.
Okay.
And then the second thing I want to teach you on is it's called incentive spirometry. So I've got this is called an incentive spirometer, if you just want to hold that.
Sure.
And what you would do, and you don't have to do this, I'm just going to teach you how to do it, but what you would do is you want to do this about 10 times an hour, and you want to take in deep breath, a deep breath and hold it for 2 to 5 seconds, and then blow into the spirometer. And what that helps is you have what's called alveoli in your lungs, and it will help expand your lungs to help you breathe better.
Okay.
All right. And then for the deep, for the turn, cough, and deep breathe, if you want to do that every 2 hours, just to help loosen up that mucus
Okay.
and get that out of your lungs. All right, perfect. Now the next part of our assessment is going to be the cardiac assessment. And so what I'm going to do is I'm going to actually lean you back. We're going to just lean you back about 45-degree angle. And I'm going to have you turn your head to the right. What I'm doing is I'm just looking for any, you have what's called a jugular vein over here. I'm just looking to see if it's distended at all. And if you could turn back to the left. And I don't see any distension in your jugular vein, which is good. Perfect. All right. Now I'm going to listen to your heart. All right, now I'm going to go on the second intercostal space, and this is actually your aortic valve. And I'm just going to listen to your heart. I'm going to move over to the pulmonic valve, which is just on the left side of your sternum at your second intercostal space. And we'll move down to your third intercostal space, which is called Erb's Point, which is another pulmonic valve sound. And it's halfway down your heart. Now I'm going to move down to your fourth intercostal space, and that is your tricuspid valve. All right, and for the fifth spot, and the last and final spot is going to be on your fifth intercostal space, but I'll need you to displace your breast again on the lift. And I'm just going to go ahead and take what's called an apical pulse. Okay, got 70. All right, now I'm going to listen for any murmurs. I'm going to do the same exact thing I just did, but I'll listen for murmurs. So I'm going back to the aortic valve. I'm going to the pulmonic valve. To Erb's Point. To the tricuspid valve. All right, and if you could displace your breast one more time, and I'm going to listen to your mitral valve. Thank you. Okay, perfect. All right. So the next part of our cardiac assessment is I'm going to just check for any edema, which is just swelling in your hands. And I'm going to check your pulses. No edema on your right arm. I'm going to check your capillary refills. What this is just your blood flow. Is that 2 seconds? At 2 seconds on bilateral. I'm going to check your radial pulse. It's a +2 bilateral. Okay, I'm going to check edema down in your legs now. I'm just going to roll your legs up. Okay. There's no edema in her right leg. No edema in her left leg. I'm just checking that anterior tibialis or dorsalis pulse. So +2 bilaterally on the posterior tibialis. +2 bilaterally. And the other pulses that I would normally check if I didn't feel pulses there, I would go up into the popliteal, the femoral artery, and then the radial artery, the brachial artery, and the axillary artery. Yeah. Perfect. I think that concludes everything. And, all right. Do you have any questions?
No, I don't think so.
Okay, I believe we've covered everything that we need to cover today. And I'll just go ahead and record this in your record so everyone else can see it, especially your provider. And you have a great day, Ms. Reed.
Oh, thank you.